sometimes the hardest people to treat are the patients who have loved ones who are getting in the way of care. And this happened one day here at Kettering Health Hamilton, the ER. Patient had broken her arm, drove herself to the hospital, got a speeding ticket on the way, had a police escort, came in, and then it informed you, Trudi, her nurse, said, I got to get back home. And you looked at her and said, that ain't happening.
Correct.
And so you asked her and you said, well, what do you need to do, or what's so important that you got to leave here and not get care? And you found out that she had a loved one with 4 legs. And what was the loved one's name?
Lucy.
So Lucy's a dog, but Lucy had what?
Diabetes.
Diabetes, and so needed insulin. And so you actually got somebody, your husband,
Yes.
to take the dog to the vet to get boarded and get taken care of, so that way the patient could calm down.
Yeah.
And you could address really what was going on with her.
She actually needed to be transferred to Kettering, Maine, so we really needed to ensure that she was going to be taken care of as well as her dog, because the dog was out in the parking lot in the car. Well,
Trudi is our Living the Mission Award recipient, and so you were recognized by Jen Olds for this story, but you have a profound impact on your team around you, and working in the ER can be a bit hectic. And so tell me what you love about working here in the ER, Trudi.
I love the coworkers. They're very much like family. I love the environment. It is like family here. I've been here at the hospital for a number of years, just a new role. Everyone here is just like a close-knit group of people who are always willing to go above and beyond to help each other.
So I had a community member call me and said, hey, could you check on a loved one? They're in your emergency department. So I had our team go down, and then I found out that you were the nurse. And so when I called them back and said, hey, the person you're worried about, they're getting great care, and Trudi's the nurse, they go, oh, I know Trudi. She's excellent. And so multiple people know you as a calm, cool, collected professional, but you've always got a smile. So what's one piece of advice that you would give to folks if they're thinking about going into nursing and wanting to make an impact in patients' lives just like you?
I kind of talk as I precept new nurses is to just really go into it with an open heart and just enjoy what you do, love what you do. It's more than just a job, it is a passion, and you have to really just embrace all the good and the bad. And just be open to all the experiences that come with it.
Sure, because you never know what's going to walk through the doors.
You never.
Yeah.
I've been a nurse for 20 years, and every day is different.
So how do you calm your nerves when you hear those doors open and maybe an EMF squad? How do you kind of calm your nerves and get ready for that patient?
I guess being a nurse for as long as I have, I've just learned to adapt, and everything's going to be a new experience, and somebody's bad day is their bad day, not necessarily my bad day, and just be there to help them.
That's really remarkable how you're able to stay in the present and then really just adapt to meet what the patient needs. And in this case, with the patient who came in, really addressing the thing that was getting in the way of her getting the care.
All she cared about was her dog. She didn't care about what happened to her. Her arm, she just assumed that we put a cast on it and send her on her way.
Sure.
She had multiple broken ribs plus a broken arm, and she was more worried what was going to happen to her dog.
Wow. So something interesting about you've got a lot of folks who are in healthcare. So how did this become a family affair?
I was probably the first. I became a single parent with my daughter at a very young age. I had already worked in healthcare, went into nursing because I enjoyed helping others. My daughter is also a nurse here. My husband's a firefighter paramedic. My nieces and my sister-in-law are all nurses. So it's just, we all seem to have a common bond in wanting to help others. And for my husband, it's been a lifelong career. My daughter, we just kind of let her steer her way this way. She started as a biochemistry major and was like, I'm not going to do what my mom said.
But there were some embers, and you fanned those embers, huh?
Yeah, and basically, and she loves what she does as well.
And we're glad you did. Chloe's pretty special. So thank you so much for being a blessing to this patient, and for all of those patients that you interact with, for living in the present and really getting to the root of what is getting in the way of patients getting care. And so at Kettering Health Hamilton, we get to welcome new life into the world, and sometimes we hold the hands of those in life ebbs away.
Yes.
But it's the way that you treated this patient. You treated for Lucy, the dog, so that way this patient could get the care. That really defines our success. So congratulations.
Well, thank you.
And thank you for being the best of us, and thank you for being the Living the Mission Award recipient.
Well, thank you. Thank you very much.